Hi, my name's Erin, and I'm a nurse with the Loyalist Family Health Team, and I'm here today to talk to you about providing diabetes foot care in the home. Foot problems are very common in people with diabetes and can lead to some serious complications. These include peripheral neuropathy, which is nerve damage resulting in the sensation of pins and needles. And diabetes can also cause peripheral artery disease, which is poor blood flow to the legs and feet, resulting in a decrease in sensation and inability to feel a foot injury, such as a blister or a cut. Diabetes can also make these injuries more difficult to heal. Some goals of today are to learn how to provide daily foot care at home, learn prevention strategies to keep your feet healthy longer, identify concerns with your feet and when to see your doctor, and also increase awareness of the resources available to help you. A daily foot care checklist includes creating a home foot care kit, which includes nail clippers, a nail file, lotion, and a non-breakable hand mirror. You want to wash your feet in warm water using mild soap. Avoid soaking your feet as this can dry your skin. Dry your feet carefully, including in between the toes. Check your feet and in between your toes, looking for any cracks, cuts, ingrown toenails, or blisters. Use a hand mirror to help you see the bottom of your feet if you're unable to. Clean cuts or scratches with mild soap and water and cover with a dry dressing. Try to trim your toenails straight across and file any sharp edges, and avoid cutting your nails too short. Apply a good lotion to your heels and soles, and do not put lotion between your toes, as the extra moisture can promote infection. Wear fresh, clean socks and well-fitting shoes every day, and white socks will allow you to see if you have a bleeding cut or sore. Some prevention strategies. So you want to try to wear well-fitting shoes that are supportive and have low heels. Buying your shoes late in the afternoon when your feet are slightly swollen can make sure that they fit appropriately. Wear socks at night if your feet are cold. Wiggle your toes and move your feet around for a few minutes several times a day to improve blood flow and elevate your feet when sitting. Exercising regularly can help improve your circulation as well. So do not go barefoot, even indoors. You want to wear shoes or slippers inside the house and check for objects inside the shoes before wearing. Look out for any of those sneaky little stones that may have crept in. Avoid sitting or crossing your legs for long periods of time. Do not put hot water bottles or heating pads on your feet, especially if you have poor circulation. Do not use over-the-counter medications to treat corns and warts, as they can be dangerous for people with diabetes. And don't smoke. If you do smoke, please speak with Marnie or myself about the different methods that are available to help quitting. Smoking decreases circulation and healing and significantly increases the risks of amputation. When to seek treatment. Your doctor or diabetes nurse should assess your bare feet at least once per year for neuropathy, loss of circulation, and injuries. Seek treatment sooner, though, if you have corns, calluses, ingrown toenails, warts, slivers or blisters, fungal infections such as athlete's foot, or any redness, swelling, warmth, or pain in your legs or feet. And for some further resources, there's Diabetes Canada, the website, diabetes.ca, Diabetes Quebec, also in French and English. The CDC has some excellent information as well on healthy feet with diabetes. Your diabetes nurse, Marnie, and myself, Erin, and your physician. Thank you for listening, and please do not hesitate to contact your physician's office or your diabetes nurse if you have any questions or concerns after listening. Have a nice day.